In today's fast-paced world, mental health has become a crucial aspect of overall well-being.
And mental health apps have emerged as valuable tools to support individuals in managing their mental health. So as we close out Mental Health Awareness Month, let's explore some of these alternatives to therapy and understand their effectiveness. Here to talk about this questions is our relationship expert, Dr. Shonda Craft. Dr. Craft, good morning.
Good morning.
So, as a therapist yourself, do you think mental health apps can actually help us?
Yeah, I think that they serve their purpose, right? It's like everything else in life. No one solution is going to be a panacea to all of your problems. But, particularly for people who maybe have some drawbacks or some barriers to being able to access mental health services, like a therapist, due to cost or even just their location or stigma, being able to get onto your phone or your iPad or your device and access an app that is assessing mental health symptoms or even providing you with some feedback on how to address those symptoms could be really helpful. And for those people who are in therapy, it can be a really nice tool, especially if you're intentionally using it to kind of get you through those between moments in between sessions to continue to work on skills or to just reinforce what you're learning in therapy.
The apps are great. I mean, for example, I use the mindfulness app, which is great, but there are also things that apps can't necessarily do too, right?
Yeah, I mean, while there's very small research, right? There's not a lot of research on mental health apps very broadly right now. And so the research does suggest that some of these apps can be really helpful to managing mild or moderate depressive symptoms or even anxiety symptoms. But if you're somebody who has a more severe mental health issue, a more persistent mental health issue, or even you just aren't really clear what your symptoms are, they may not necessarily be effective. The other thing is that, with most technology, right, it's about user engagement. And so when people start using mental health apps, depending on how consistently they use them, that's also going to impact how effectively they are. And some of this research does suggest that people will start utilizing an app, get really excited about it for a few weeks or a few months, and then their use generally will fall off.
Mm-hmm. There's so much that goes into mental health, like in terms of your social connection, your fitness, your sleep. And I feel like there's an app for everything now. Do you recommend those apps too when we're talking about mental health?
Yeah, there is an app for that, right? That's a great statement to say. And actually, I think that point that you just made, the holistic view of mental health. Mental health is not just about what happens in our brain. It's about what's happening in our body, how well we're eating, the connections that we have with other people. And so, a fitness app, for example, could be really great to not only increase your ability to have a consistent exercise routine, but it can also reduce stress and anxiety and depression symptoms as physical activity will do. Sleep is also a really major component of our mental health. When we're tired, we're cranky, right? We don't feel our best. And sleep symptoms, whether it's increased sleepiness or decreased ability to sleep, are also signs and symptoms of potential mental health concerns. So if you're using a sleep tracking app to monitor your sleep patterns and your sleep quality, there's an opportunity for you to have some improved mood and maybe some decreased symptoms of some of these mental health concerns.
I'm thinking about like some of these nutrition apps too that have helped, like for example, apps that will help you count calories. That can be beneficial too when it comes to your overall and physical health, which is great.
Yeah, absolutely. Again, eating is changes in eating patterns is one sign or symptom of maybe a depressive episode. So people who are eating more, eating less. But we also hear people talk about just emotional eating, right? Sometimes when we've had bad news or a bad day, we're going to reach for a cookie or a carb or something that feels comforting. And so being able to maintain proper nutrition can also improve our mood and energy levels, which ultimately leads to better mental health.
AJ was mentioning a mindfulness app. What about you see all these meditation apps. Could those be helpful too? Would you recommend those to somebody who maybe is feeling really stressed?
Yeah, mindfulness is a really important tool, and it's something that you can do even if you're not in therapy. Now, some people, like myself, even, it's hard to quiet your mind, right? We're constantly thinking about all of the things that we have to do or the things that we haven't done or the needs of other people. So, being able to have a tool that really guides you through meditation and mindfulness, even if it's just, 10 seconds of closing your eyes, paying attention to your breathing or listening to the sounds around you, can again help you to kind of reset what's going on in your brain, bring some calm into your body and some clarity. So absolutely being able to practice mindfulness and meditation is key to having better mental health.
All right. Shonda, great insight. We appreciate you joining us this morning.
Thank you both. Have a great day.
You